Good morning, and thank you all for joining us today for this very important press conference, this announcement. My name is Sarah Mercer. I am the Director of Government Affairs for the California Pan-Ethnic Health Network. CPEN is a multicultural health advocacy organization working to improve the lives of communities of color in California. For our communities that we represent, this legislation is extremely important. We recently released a report published in conjunction with the UCLA Center for Health Policy and the UC Berkeley Labor Center that estimates that over 2 million, close to 3 million individuals will be eligible for subsidies in the California Benefit Exchange. And of those, 1.73 million will be from communities of color, and 1 million will be limited English proficient communities. Therefore, it's critical that these communities have access to the accurate and important information as they endeavor to enroll in health insurance. Therefore, it is my distinguished pleasure to introduce our leader in this effort, Senator Ted Lieu, who will be speaking about the legislation. Thank you.
Thank you, Sarah, for all your good work. You know, James Madison said in the Federalist Papers, if people were angels, there would be no need for government. But we know in our history that people are not angels, and that when you have an expansion of healthcare, you will have the opportunity for fraud or for scams. And in California, we expect over 7 million people to get healthcare as a result of the Federal Affordable Care Act, who did not have healthcare before. Many of these will be folks who are of limited English proficiency, lower income, small businesses, and people of color. And we want to make sure that when these marketing materials are sent to them or taught to them in a different language, that there is no deception going on. Under current law, the Department of Managed Healthcare does have prior approval authority for HMO-type insurance plans. There is no such authority for PPO insurance plans. One of the big things that my bill will do is close that huge gaping loophole and give the Department of Insurance their authorization to review marketing materials for PPO plans for people in different languages. The second thing my bill will do is it sets higher standards for how you market to folks in different languages. And third, it also requires translation services if you're going to send this information to people in Spanish or Chinese or other languages. And finally, it has some anti-fraud provisions. It basically says, look, if you're someone who works as an insurance agent, you get your license suspended and revoked under the Department of Managed Healthcare, you can't just run around and go to Department of Insurance and start doing the same thing again. So this is basically an anti-fraud bill to help protect consumers, especially those who never had access to healthcare before, to let them know that when they get a material, either in their mailbox or through their phone, that what's being taught to them is accurate. So I'm honored to have several speakers here, and let me call Sarah back, who will introduce them to you, and we'll answer any questions at the end of this conference as well. Thanks.
So as the Senator mentioned, we'll be doing Q&A after the speakers. My first speaker I'd like to introduce is Ron Coleman with the California Immigrant Policy Center.
Good morning, everybody. My name is Ronald Coleman with the California Immigrant Policy Center, and we're here today as co-sponsors of SB 1313 because we know that immigrant families will be helped by this bill. Immigrants are often targeted by a variety of bad actors. We see rampant wage theft in the workplace, and we see citizenship scams. Immigrants are targeted by criminals who know that they often carry cash, or that they're often afraid to report crimes, and even act as witnesses. We need look no further than the recent mortgage crisis to see that immigrants were preyed upon due to their ethnicity and limited English proficiency. With unprecedented new health care coverage opportunities available to Californians through the Affordable Care Act, we fear that immigrants once again will be preyed upon and be prime targets for those bad actors who are eager to take advantage of consumers who are desperate to get their family health care coverage. There is likely to be massive confusion in these communities, particularly among mixed status families and the undocumented, about who may and who may not be able to participate in the newly expanded programs. There will be confusion around the individual mandate as well. The last thing that we want to see is people paying expensive, high prices for worthless junk insurance that doesn't offer basic coverage for medical services. Unfortunately, we also know that immigrants are taken advantage of by people that speak their language and often know how to gain their trust to perpetrate their illegal scams. We don't have to stand for this. SB 1313 takes a proactive approach to protect California consumers from being set up and abused and scammed. It will help us meet the goals of federal health reform, giving millions of newly eligible healthcare consumers a chance to benefit from the new law. Our immigrant communities need to know that the information they get about healthcare is accurate and reliable. We need them to enter this new phase with confidence. SB 1313 helps us do that. And we are extremely grateful for Senator Liu's leadership and commitment to this critical issue, which will protect millions of California consumers and working families as we continue to implement federal health reform in our state. Thank you.
We know that there are deceptive marketing techniques that are currently used within the system, and we have several we have 3 community members who are going to speak to some of these examples today. The first I'd like to introduce is Celia Valdez. Celia is the Director of Outreach and Education with the Maternal and Child Health Access. After Celia will be speaking Miwa Lee, who is the Development Director with the Korean Resource Center, and finally Angelica Sales with Chirla will also be addressing you.
Good morning and thank you very much. My name is Celia Valdez and I am the Director of Outreach and Education with Maternal and Child Health Access, which is a health advocacy organization here in Los Angeles. For the past 15 years, MCH Access has assisted thousands of families with enrollment into health programs, utilization, and problems related to retention. We have seen cases involving unscrupulous plans that target families at local health and dental clinics, schools, churches, and even at work sites, misrepresenting themselves as non-biased health enrollment assisters who instead steer unsuspecting families into their plans for their own financial gain. Most of the families targeted are non-English speaking and have very low literacy skills. We strongly support SB 1313 and thank the Senator for sponsoring this bill. This bill will protect healthcare consumers from being targeted and lied to by deceptive marketing practices. The need for such protection is even more important as we prepare for the full implementation of the Affordable Care Act in 2014. Through the years, we've seen hundreds of cases where individuals and families struggle with being assigned to managed care plans without their prior knowledge or understanding. Others have signed up with managed care dental plans that they never needed in the first place because of deceptive marketing enrollment practices. For example, we've had a child suffering from severe tooth decay and in a lot of pain. His mother took him to his local neighboring dentist. After running his Medi-Cal eligibility, the dentist informed the family that this child had been enrolled into a dental managed care plan. The mother had no idea how this had happened. This enrollment into a managed care plan was impeding his access to see his local neighboring dentist. Now he had to seek treatment outside with an assigned dental plan, another provider away from town. She told us she had recently visited the WIC office and spoke to a gentleman who offered information on Medi-Cal. She also handed her son's Medi-Cal information to him. All the written information that had been presented to her was in English. She was only Spanish speaking. She did sign a document, she recalled. We later learned from WIC that this was a Medi-Cal, so-called Medi-Cal representative, who had been targeting Medi-Cal recipients at their site, claiming to be providing information on Medi-Cal, but instead was enrolling them into a specific dental plan for financial gain. Another example is of a girl who was also suffering from severe toothache, and her mother contacted us because she had been waiting 4 months to be seen by her managed care dental provider. She had no idea how her daughter had been enrolled into a plan, and when we followed up, we realized that the mother had consented to an enrollment, but the mother had no notion of how this had happened. We learned that her care had been delayed. There had been a requirement from the so-called dental plan, who was offering a much more comprehensive service to the family, that the child had to be seen by a regular dentist 4 times and be deemed uncooperative before she can seek specialty services. She had been waiting 4 months to see a specialist. Lastly, outreach and enrollment organizations like ours have been offered grants and contracts by so-called enrollment groups who are really connected to a dental plan. They've offered us compensation for enrolling and steering families into their plan. And these groups right now are everywhere and targeting everyone they possibly can. These are just a few examples of current scams that we think could occur on a larger scale with healthcare reform. Our clients struggle to understand the system and unfortunately believe that friendly people who offer to help their families. We know that this is not the case. We need SB 1313 to protect our communities who stand to benefit the most from increased access to health care coverage. Thank you very much.
So I guess we're going to do round robin style. My name is Miwa Lee. I'm from the Korean Resource Center. KRC is a grassroots organization that has been helping low-income and limited English proficient LEP families and seniors for the past 29 years. I'm here today with Mrs. Jamana Kim, the community health education organizer at KRC, and two members of our community, one of which I will be speaking about later. We're actively supporting SB Senate Bill 1313 because we have seen an alarming increase in fraud and deceptive marketing that seems to be targeted at our community. An estimated 83% of our community does not speak English well, and 23% are low-income seniors, making them naturally more at risk of scams. For example, Mrs. Moon, a senior on Medi-Cal, received numerous calls from someone who said the Medi-Cal coverage was going to be discontinued and tried to persuade her to sign up with an HMO. Fortunately for Mrs. she came to us before she signed anything. Mrs. Kim asked if she had received any written communications from the Department of Public Social Services, DPSS. No, she hadn't. Mrs. Kim explained that DPSS is in charge of Medi-Cal and would always send at least a letter for something as important as a change in eligibility status, which meant that the phone caller was wrong. Mrs. was still worried that her coverage was in jeopardy, so Mrs. Kim called DPSS in her presence to confirm that they had not called her. It was a scammer. Additionally, during last year's open enrollment period, we saw one-page ads offering comprehensive health plans that covered dental, vision, acupuncture, chiropractor, fitness center, and much more, all in addition to general medical coverage. Our low-income seniors often respond to such ads because they're attracted to the dental coverage. That's what happened to Mr. Kim, who's sitting next to me today. He's a dual coverage senior. In other words, he has both Medi-Cal and Medicare. Even after Mr. Kim told the agent that he wanted a plan with full dental coverage, the agent signed him up for an HMO plan that only provides teeth cleaning twice a year. Now, whenever he needs a dental treatment, his dentist has to ask for permission to treat him and then wait for the answer, sometimes for as long as 6 weeks, and so far, the HMO has always refused. As you can see from these cases, the current healthcare system is already complicated enough, and unscrupulous agents are preying on low-income LEP community members. The potential for harm is many times greater as we go forward with the health reform implementation. SB 1313 is a proactive bill that strengthens consumer protection and is critical for the protection of our most vulnerable community members. Thank you.
Good morning, everybody. My name is Angelica Salas. I'm the Executive Director of Chairman of the Coalition for Humane Immigrant Rights of Los Angeles, a regional organization that works to advance the rights of immigrants and refugees. I would like to start by commending Senator Ted Lieu for introducing SB 1313 and its sponsors for inviting me to convey Chairman's support for this bill. California has the largest population of immigrants of any state in the United States. Many of California's immigrant families are mixed status, as was previously noted. In Los Angeles alone, almost 84% of our families have at least one immigrant in their household. Well over half of California's children are either immigrants or the children of immigrants. And in Los Angeles, 3/4 of the children have at least one foreign, one parent. Based on the current demographics, the participation of immigrants in the new health care programs is critical to ensure that health care cost is affordable, that our families enroll, and that in doing so, our state becomes a model for the rest of the nation. Unfortunately, immigrant communities are prone to deceptive marketing practices as a result of their immigration status and language barriers. There are so many examples which have already been noted. But what we see every day are immigrants who have been defrauded by unscrupulous immigration consultants that promise to fix their immigration status. What we also see are many immigrants who have been victims of predatory lending and as a result have lost their home. What is the motivation from all these unscrupulous actors? Profit. Profit from our community. They see a community that is in need. They see a community that is seeking help. And what they, instead of offering that help, what they're just making a decision as to how to profit from that need. The new healthcare law is very complex, so it's very likely that immigrants would be confused about the eligibility requirements as well as about the individual mandate. This bill will insert confidence about our new healthcare law among the vulnerable population by preventing deceptive and fraudulent practices by unscrupulous individuals. CHEERLA will work with Senator Ted Lieu, with its sponsors of this bill, to make our state a leader in consumer protection as part of the healthcare reform law. Thank you.
So thank you very much. We're going to open it up to questions. I'd also like to note that Consumers Union is also a co-sponsor of this bill, as well as CPEN and the California Immigrant Policy Center. So we'd love to take questions from the audience. Any reporters? Apparently we did such a good job presenting the bill. Congratulations, Senator.
Where does it supposed to go? Who's going to review this? Where is it going from here? You're introducing it, and then where does it go from here?
So the bill has been introduced, SB 1313, and it will go through a policy committee, Senate Health Committee. Hopefully it'll go through the Senate floor, and then in the fall through the Assembly floor, and then to the governor. So that'll be the path.
Is there a date? Is it going to go?
It will take effect, if signed into law, it will take effect January 1st of next year. April 18th is the Senate Health Committee. Yes.
Is there a cost associated with the bill that might impact the state budget?
There will be some cost, but it will largely be funded through additional fees through a special fund through the Department of Insurance. So it will likely be a very small cost for the general fund or none at all. Any other questions? Yes.
What can advocates and community members do to make sure that other senators, other assembly people vote favorably on this bill?
So one is to contact the members of the Senate Health Committee. All this information is on the websites of the California legislature. And in addition, to let the governor know when the time comes that this is an important bill for immigrants and those who don't have English as their first language.
What are the potential financial loss per year basis on separate healthcare? And also, I have another question on the senator. What's your motivation for introducing this bill?
So the motivation is, in my years in legislature, I've simply seen too many scams and frauds. I worked on predatory lending. I passed some comprehensive legislation against banks and to stop subprime fraud. And I've seen it happen in the property tax contracts where people get all sorts of letters telling them, hey, if you pay us $300, we'll reduce your property taxes. It's just not true. I see scams everywhere, and it's very clear to me that currently we have fraud going on right now in the healthcare market. We're going to have a lot more when all of a sudden the mandate comes down and says, look, you got to buy health insurance or you're going to get penalized. And then you have folks who are in this situation and they may not know that when someone comes and says, buy this cheap health insurance, they'll satisfy their federal mandate, when in fact they won't. It might just be cancer-only insurance. It might be insurance that just covers dentistry. None of those would actually satisfy the federal health care mandate. Or they may get insurance that says it will cover all these things when in fact it does not. So there are all sorts of opportunities for fraud, especially when you can have marketing materials go in a different language that no one gets to review or even see. And so this law will put in a prior approval authority for the Department of Insurance to make sure they can look at that before it goes out to different communities. I didn't hear your first question.
So the potential, the loss, financial, amount of financial loss per year, if you have data.
I have
It's
Sarah answer that.
millions of dollars is being lost. Data.
We don't have specific financial data on what are the direct consumer costs. I think looking at, for example, the mortgage crisis and what consumers faced with that is a good example of what could potentially happen. I think the direct costs are actually to the health of the individual. And those are the costs that also are associated over the long term of not getting the kinds of care that you need or getting enrolled into a program that doesn't meet your needs. And some of the clients also spoke to some of those issues today, is having to wait 4 months before your child can get dental coverage because they didn't realize that they were in a managed care program that had a requirement that they had to be seen 4 times before they could actually see a specialist. So that's the type of information that's not being adequately communicated to consumers. So it is a cost that's financial, but I think the bigger burden is actually the cost to the health of the consumer.
If there's no other questions, we will be here to answer individual questions. We have one last one. Go ahead.
Sure. Is there a penalty associated with this bill to these unscrupulous fraudulent providers? And if not, or if there is, who would take care of that? And if not, what can we do to make sure?
So that's a good question. There's a whole host of penalties in current law for fraud and misrepresentation. This bill actually specifically puts in provision that says you cannot misrepresent the terms of the Federal Affordable Care Act. And if you do, you're going to be liable. And then we put in a private right of action, so if the Department of Insurance or Managed Healthcare take no action, then individuals can actually sue under this law. So we believe it will be effectively enforced. And we'll be here to answer any individual questions as well. Thank you very much.